Former Deputy Health Minister Dr. Okoboy has commended Ghanaians for the level of interest shown in the ongoing COVID-19 mass vaccination exercise. According to him, the massive patronage by Ghanaians can be attributed to the public broadcast of the vaccination of the president and other government officials. Dr. Okoboy spoke on the sidelines of a presentation of personal protective equipment by Chief Executive of Odilia Ghana Limited to the children's ward of the 37 military hospital.
Before the vaccine rollout, we did some research about vaccine acceptance. It came out that 63% of Ghanaians were not ready to take the vaccine in Accra. So you can imagine what will happen in the rural area. But luckily, or thankfully by the grace of God, immediately the president and the vice and key officials took the vaccine. That particular attitude or stance started to change. And I'm happy to say that this morning, I've got a lot of calls. People who don't even belong to group 1, who are asking me whether there's a way they can get vaccinated. That is assuring. It means that we've come on board.
Meanwhile, headaches, body pains, chills and mild fevers, those are the side effects being reported by persons who have taken the jab. But according to Dr. Okoboy, those are adverse reactions that would clear soon.
Got my shot on Tuesday. What I experienced, I think, is what a lot of people are experiencing, which is some pain at the site of the injection, even 24 hours, that's a day later. And then when you wake up in the morning, maybe a little bit of joint pain, and it's as if you've gone to run some marathon and all that. But it heals within a period of 24 hours. So I've not taken paracetamol, I'm not taking anything. Within 48 hours, I was very okay. In fact, after the injection, I was able to eat, do my rounds. It's just when I was waking up that I felt some way. And when people call me, I go like, you can some 2 tablets of paracetamol. Some didn't even need it, and then you are well. So the benefits, like I put on some platform, are huge. When you get the vaccine, we hear of 70% efficacy with AstraZeneca, 95% with Pfizer, 92 or 93 with Sputnik. All these figures refer to protection from getting the virus. It means 70 people out of 100, when they get the vaccine, would never get COVID-19. But the 30% who might get it, there is a greater benefit, which is that you are protected from severe illness. It means that your condition will be mild to moderate. You will not end up at ICU, at Ghana East or University of Ghana Medical Center. And the protection from death is almost 100% for all the vaccines. So I tell people that all the vaccines have one thing in common. They keep you away from the ICU and from the medical ward for COVID-19. Also, those 90-70 is about whether you get the virus or not. So the vaccines provide that answer. And so there are so many benefits for getting the vaccine that if you get the opportunity, don't hesitate at all. Don't say that I'm waiting for the 95% or for the 80%. Whichever one is approved by Ghana's FDA for use will save you from death and from severe illness. And that's why I encourage people to go for the vaccine. As a country, we are very strict about the vaccines we receive. All the vaccines that came to Ghana, we had the batch numbers before they got here. Batch numbers mean that every serial number, we got the documents. So that when they got to our airport, we had to check the vaccines versus their serial number. Because there can be fake ones in town. Like you've heard about South Africa and China, they're busting fake gangs. So all these things are part of our, are on the table. We are minded by these issues.